Hi, Cheryl.
Hi.
My name's Allysia. I'm going to do a physical exam on you today, okay?
Okay.
So, do you have any medical problems at all?
No.
Okay. Prior to this, we would have gotten some vital signs on you and your height and weight. And just overall assessment, when I walk in the room, you look like you're fit, you're not underweight or overweight, your posture is good, and your mood seems like you're very excited to be here today, right? Okay. So we're going to do a head-to-toe assessment on you, and throughout the exam I'm going to note the temperature of your skin and any abnormalities that would find any sores or bulges or anything like that, okay?
Mm-hmm.
So if you feel any pain during any part of it, just let me know.
Okay.
So noting the size of your head looks normal to me, and your facial features are symmetrical, your ears are in line with your eyes on both sides. And we're going to start with the shape of your head, looks good. Palpate each lobe on your head for any bulging or masses. And I don't feel anything. Any pain there, Cheryl?
No.
Okay, moving towards your ears, I'm going to palpate down each side. And I'm going to note the skin and the color behind your ears. I'm going to check your temporal pulse on each side. And it is equal. I'm going to check for TMJ. Can you open your mouth and close? Again? Okay. And there's no cracking or crepitus there. So we're going to start with your neck and your head and do some physical range of motion and check your lymph nodes, okay? Do you have any sinus problems at all?
No.
Okay. So just checking your sinuses. No pain there?
Mm-mm.
No drainage in your nose right now?
No.
Okay. Your lymph nodes, we're going to check your preauricular and your postauricular, your occipital, submental, and submandibular, jugular, your cervical, and then your deep cervical. Can you turn your head a little bit? Pressing a little harder down the cervical chain. I don't feel any bulging. And your clavicular, and they all feel good, okay? A little bit of range of motion on your head and neck. I'm going to have you look to the left and to the right, and flex down, extend up, and hyperextend. Very good. Okay. And do that again. I'm just going to apply a little resistance, okay? And the other side. Down. Up. Okay, great. Okay, so moving back up to your eyes. Can you raise your eyebrows for me? And close your eyes real tight. Okay, your eyebrows are symmetrical. Both of your irises are blue. You'll have one blue eye and one brown eye. Oh, your pupils are forward and reactive. And your sclera looks nice and white and clear. There's no drainage. Going down on your conjunctiva is nice and pink. I can see the blood vessels in your eyes really nice. We're just going to do a field test on you, okay? So look at my pen and don't move your head at all. We're going to test 6 fields. Do you wear glasses, Trell?
Yes.
Okay. Very good. And your movement is nice and smooth and no nystagmus noted. Okay. We're going to move down towards your nose. And the skin and temperature are fine. I'm going to take a quick peek inside your nose. Nice and pink. Nasal cavity looks good. And then we're going to move towards your mouth. Can you open your mouth for me? Say ah. Uvula rises nicely as midline. Tonsils look a little enlarged and red, huh? You get a lot of sore throats?
Mm-hmm.
Okay, stick your tongue out for me. And there's no lesions or sores. Everything's nice and moist. Your teeth look nice. Let me see your gums. Okay. Great. Okay. That good?
That's good.
Just count the last second. Okay, Cheryl, this part of the exam I'm going to just do your thorax inspection and note that your AP to lateral is a 2-to-1 ratio. There's no barrel chest on you. I'm going to inspect the skin at this point, feel for temperature. I don't note any abnormalities on your back just by inspection. I'm going to ask you to tilt your head down and find T1, and I'm just going to do some light palpating all the way down your spine. Is there any tenderness there, Trill?
No.
Okay, and then back up on each side. Again, I'm not feeling any spasms. Do you have any tenderness here?
No.
All the way up. No bulging noted. Any tenderness there, Cheryl?
Nope.
Okay. So at this point, I'm going to start to listen to you, and I'm just going to ask you to take some nice deep breaths.
Okay.
Find T1 and T3. And I'm going to start to listen. Very nice. Between the scapular, move my way down left and right side. And I'm hearing some broncho-vesicular sounds. Nice. And I'm noting that he's just breathing normally. He doesn't seem to be having any trouble breathing. Still listening for vesicular sounds. And then I'm just going to wrap myself around here. Okay, very good. And then I would do the same thing on this side. I'm going to ask you to swing your legs to the front. And at this point I'm also inspecting his chest. I see that he has a couple tattoos here that look like they're old and they're not infected, anything like that. I'm noting the symmetry of his shoulders and his clavicle. All looks in line here. Again, the skin is nice and warm. And again, just take some nice deep breaths. I'm going to listen above the clavicle here. And then right below. Good. And again, I'm noting vesicular, nice clear breath sounds. All the way down. You don't have to breathe so heavy. And everything sounds nice and clear. Thanks, Cheryl.
Sure.
Hey, Cheryl, at this point we're going to listen to your heart sounds, okay? You could just breathe normally for me, listening with the diaphragm of my stethoscope. I'm going to find your second intercostal space on the right side and listen to your aortic area. Over to the other side, your pulmonic area. Down to the third intercostal space, that's called Erb's Point. And then the fourth or fifth, your tricuspid area. Then over to the fifth, midclavicular, is your mitral. And that's where I could take your apical pulse. Sounds nice and strong. Then I'm going to flip the bell of my stethoscope and listen again over those areas for any murmurs. I'm not noting any murmurs. Nice, strong breath sounds there. I'm also going to take this point to listen for any murmurs. So I'm going to ask you to hold your breath for a minute as I listen. I don't hear any brewery. Other side, take a nice deep breath and then do it again. Okay, it's nice and clear. We're going to move to your upper extremities, Cheryl, and I'm going to be just noting your skin and your temperature, and we're going to do some range of motion moves on you, okay?
Okay.
So, nice symmetrical shoulders here. You palpate those shoulders. You have any pain there, Cheryl?
No.
Other one. Again, his skin looks nice. You hold your arms out. Other side. Okay. I'm gonna do a little range of motion with your wrist down here. Does this hurt?
No.
Yes?
No.
Palpate your wrist for any bulges or abnormalities. Do the same thing with your fingers. Flex your fingers out. Make a fist. Put your hand up, down. Any pain when you do that?
No.
Same thing on this side. Fingers, you have a laceration here. Looks kind of fresh. Did you have stitches there?
Yes.
Okay. There's no signs of irritation or infection. When did your stitches come out?
2 days ago.
Okay. And the same thing. Put your hands out, down, hands out, and flip them back and forth fast. Okay, very good. Just a couple exercises to show you range of motion. Can you put your arms on top and back down? And extend in front of you, cross over, and then in the back. Okay, any pain there at all?
No.
Can you make a fist? Think a muscle? I'm gonna try to pull down, you hold me back.
Okay.
Okay. Obviously I can't move. Again on this side. Okay. You dangle your hand like that. And then I'm just gonna try to pull your arm, very good. And on this side. Okay, great. Okay, obviously you have full range of motion. I didn't notice any kind of problems there. I'm gonna ask you to hold your arm up. I'm just gonna palpate the inside of your arm here, for your lymph nodes, in your armpit, and the anterior, and the posterior, and then put your arm down, and the lateral lymph nodes, and then don't feel anything. Same thing on the other side, right in the middle, the anterior, posterior, and hold your arm down, and the lateral. Very good. Okay, Cheryl, for this part of the exam I have you laying flat on the bed. And I'm just going to talk to you for a minute about breast exams because I know you are a young male and you think you don't have a chance of getting breast cancer, but that's actually not true. I've been a nurse for almost 15 years. I've had one patient so far that was unfortunate and got breast cancer as a male. So for the women and for yourself, what you would do is put your arm up above your head, and with your other hand you would just palpate in each area around your chest and nipple area. Also, just something to note, if you ever had a scab or a discoloration, it would be something for you to tell the doctor about. So, looking at the shape and the contour of your chest and your abdomen, it appears to be flat, and can't even pitch an inch of fat on you. For thin people, you are able to see the pulsating of the abdominal aorta, and you can see that slightly on you. So we're just going to start by listening to your bowel sounds. And I'm going to start in the right lower quadrant. And I'm going to listen for bowel activity in each quadrant. And there are bowel sounds present in each quadrant. I'm also going to listen over the abdominal aorta, just for any brood in the vessels, but I don't hear that. Any issues with eating or your digestive system?
No.
Okay, I'm just going to do some light palpation in each quadrant. Any pain or tenderness there?
No.
Okay. Okay. This is also the part of the exam where we would listen and feel your femoral pulses on each side. So we're going to move down to your lower extremities, and I note that both of your legs look symmetrical, look like you have muscular legs. I don't note any rashes or dry skin. Coming down to your toes, I'm just check for your capillary refill in your toes as I did your fingers, and they look fine. Look between your toes and there's no rash or calluses that I see. Maybe a little bit of calluses on your feet there. I'm going to ask you to do a couple things for me. First thing is push against my fingers and then pull back. Very good. And then bend your knee for me when you push down. Okay, good. Can you lift your leg up and push down? Okay, other one. And push down. Okay, you can bend your knee up for me and rotate out and in. No problems there?
No.
Same thing on the other one. Okay, good. I'm going to ask you to do a heel to shin test for me, and that's what we do to note your coordination. You can put your heel up on your knee here and slide it down and then back up. I see you're able to do that on each side. Okay, great. Last thing I'm going to do is just check for your pulses down here, your pedal pulse. On the inside, and they're both strong and equal. Okay, Cheryl, for this part of the exam, I'm going to have you sit on the side of the bed. And I note your strength when you sat up, you had no problems doing that. So this is the neuro assessment, a couple questions and a couple tests to assess your neuro status, okay?
Okay.
Can you close your eyes for me? I'm going to put an object in your hand, and I want you to tell me what that object is.
The object's a spoon.
Great. Okay, and then you can keep your eyes closed. And again with your hand, I'm going to just draw a number on your hand. If you could tell me what number that is.
It's number 7.
Okay, great. Okay, you can open up your eyes now. I'm gonna have you touch my finger and touch the tip of your nose, and I want you to go back and forth as fast as you can.
Okay.
Okay, go ahead. Okay, other arm. And now I want you to reverse it, okay?
Oh, I'm sorry.
And again with your other hand. Okay, great. I'm gonna just do a couple more tests on you as you're sitting there. I have an object that's sharp on one end and dull on the other. So on your arms and your legs, I'm gonna test whether you can feel. I'm gonna check your face too, your senses on whether you can tell if it's sharp or dull.
Okay.
So keep your eyes closed.
Dull.
Okay.
Sharp. Sharp. Dull.
Okay.
Dull. Sharp. Dull. Sharp. Sharp.
Okay, great. Okay, you can stand up for me and face the window here. I'm going to ask you to bend down slowly, touch your feet, and I'm going to look at the curvature of your spine. That's how we check for scoliosis, and your spine looks great. You can stand back up and face me, and we're going to just do some extension and flexions to check your range of motion there. Anything hurt when you do that? Do you
No.
feel limited at all?
No.
Okay. I'm going to have you stand up against the wall here, and I'm going to adjust the camera so we can check out your feet there. I'm going to ask you to walk on your tippy toes. Okay, great. And then turn around and walk on your heels. Okay. Any problems doing that at all?
No.
Okay, the last test, I'm just going to have you face me. And I'm going to have you close your eyes. Hands at your side. And I want you to stand there, and we're going to just test your balance. Feel dizzy or anything?
No.
Okay, great. You can open up your eyes. Okay, Trill, that completes our exam. Thank you very much.
Thank you.
You're a very healthy guy.
Thank you.